Hi there. Today I'd like to give you some basic information about the new COVID-19 vaccine. First of all, I highly recommend that everyone get it. It is safe and it's been shown to be over 90% effective in preventing you from getting COVID. There are very few people who are in a category that should not get the vaccine, and I will talk to you about that in a few minutes. So first, what is the vaccine? It is an mRNA vaccine, and what mRNA vaccines do is they give information to our immune systems about how to fight a certain disease. What this vaccine does not do, or it does not have in it, it is not a live vaccine and it doesn't alter our DNA. Both vaccines, like I said, have demonstrated an effectiveness of over 90%. And this was true no matter your age, your racial background, or your ethnic background. The Pfizer vaccine has been approved for people over 16 years old, and the Moderna vaccine has been approved for people over 18 years old. The other difference between the two vaccines is that they're both actually two-dose vaccine series, but the Pfizer product is given 21 days apart and the Moderna vaccine is given 28 days apart. I've had a lot of questions about what's in the vaccine. Neither one of these vaccines contains any preservatives. They do contain inactive ingredients such as salts, sugars, and lipids. And they do contain polyethylene glycol, or PEG, and polysorbates. Both of these are also considered inactive ingredients, and they help stabilize the vaccine. PEGs are also used in laxatives that people take when they do a bowel prep for a colonoscopy procedure. One thing that's important to know about these two ingredients, if someone has a sensitivity or an allergy to a PEG, they can also have a sensitivity to a polysorbate. So it is important to know what ingredients are in the vaccine you're receiving. Local and whole body reactions, particularly after the second dose, do occur much like other vaccinations. But they do resolve relatively quickly, usually within a few days after your second vaccine. These reactions include fever, chills, fatigue, pain, redness, or swelling at the injection site, swollen lymph nodes in the arm that you received the vaccine, headache, rarely vomiting and diarrhea, and muscle aches and bone aches. You can take Motrin or Tylenol after you get your vaccine if you have some of these local or whole body reactions, but they do recommend that you don't pre-medicate before you go get your vaccine because there's not enough information about what this could do to possibly prevent your body from developing a strong immune response. So take the Tylenol or Motrin after your shot if you need it, not before. Unless you develop an absolute contraindication to getting the vaccination, you should proceed with both shots so that you develop the full-blown protection against COVID. Right now, the CDC has not approved any vaccine for just a one-shot series. The other thing that you should do is you should receive the same product for both vaccines. So if you get the Moderna vaccine first, then you should get the Moderna vaccine for your second shot. Protection after getting the vaccine is not immediate. The two-dose series will take approximately 1 to 2 weeks after your second dose for you to be considered fully protected against COVID. So unfortunately, no vaccine is 100% effective. And one of the things we don't know yet about this vaccine is how effective it is in preventing transmission or giving COVID to someone else. The preliminary data that's coming out is saying, yes, we think it does prevent transmission, but until we know more about the full effectiveness of this vaccine, the CDC does recommend, even after you're vaccinated, that you continue to do things like masking, hand washing, social distancing, quarantining, all of those good things that will help people from getting COVID or from you from getting COVID until we know more. When you get your vaccine, they're going to recommend that you register at a site called vSafe. vSafe is a smartphone-based tool that uses text messaging and web surveys to monitor how you're doing after your vaccine. It gives you a chance to tell the CDC what your reactions are so they can compile more data to share with us about how people are tolerating the vaccine. Depending on your answers, the CDC may call you or check in with you to get more information. They can also remind you to get your second dose of the vaccine. For those who've had COVID-19 or had a positive test, the CDC says you can choose to wait 90 days after your positive test to get the vaccine. They think that reinfection with COVID is really uncommon within the first 90 days after you test positive for COVID. So who should not get the vaccine? There's only one group of people that should not, and those people are those that have a severe allergic reaction or anaphylaxis to any product in the 2 vaccines that have been approved to be given. So in the Pfizer or Moderna vaccine, if someone has a severe allergic reaction, they are the only group of people that should not receive a follow-on dose of this. There's a second group of people that should use caution in getting the vaccine, and these people are those who've had a severe allergic reaction or anaphylaxis to any other injectable therapy or vaccine. And this again is not just side effects from a vaccine, but the anaphylaxis from receiving a vaccine. If you are one of those people, they recommend that you talk to your doctor and ask, is it safe for me to get the COVID-19 vaccine? When you get the vaccine, these people that have had these kind of histories are observed for longer time after their vaccine than someone else. So anyone else should and is encouraged to get the vaccine. And even people with a history of other allergies to food, pet, environmental, or even latex, people with allergy to oral medications, or who've had non-serious allergic reactions to other vaccines or injectables, family history of anaphylaxis, all of these people, including immunocompromised and pregnant and lactating or breastfeeding women, it's safe, they're saying, for all of these people to get the vaccine. If you have concerns, of course, talk with your doctor or healthcare provider. Give me a call and we can try to figure it out together. So one of the last questions I want to address is how to register to get the vaccine. You've heard that in the news and probably maybe even experienced it yourself. If you live in Greene County, the Greene County Public Health Department is providing a registration site on their webpage for you to be notified when your group is called up. They will call you on the phone. And so to register for that, you just go to their website, and then that is gcph.info. And that right when you log in, there's a banner right there for you to register to receive notification. Anyone else in other counties, go to your county's public health webpage, and there should be information there on how to find out where they're giving vaccines. The other way that I have recently seen notification of vaccine clinics is through the news, on the local news channels and through emails. If you have signed up to receive their emails, they're telling people, go to this website, register. You do not have to be a resident of that county or of that healthcare system. So if you're not a Kettering patient, you can still go to a Kettering site and get the vaccination. So watch all of your avenues of news on the web, on social media. I believe they're notifying people of those vaccine clinics. So okay, I think that's it. All the information that I have today. To recap, I highly encourage all of you to get the vaccine. And if you have questions about how to register to get the vaccine, or if you have concerns if you should get it, please call me and I will walk you through it. We'll find the answer together. Thanks, and have a great week.